So if you tear a ligament in your knee, the orthopedic protocol is just immediate. It's aggressive. I mean, before you even leave the clinic, the doctor hands you this rigid, multi-month physical therapy schedule. You have a very clear blueprint for healing.
Right, you know exactly what to do.
Exactly. But if you push a human being out of your body, which is an event that stretches your pelvic floor muscles up to, what, 3.26 times their resting length?
Yeah, that's over 250%.
Over 250%. And the standard of care in the U.S. is a single 6-week checkup where you are usually just told, you're cleared for everything, with virtually zero musculoskeletal guidance.
It is honestly a profound medical blind spot. We treat sports injuries with this intense guided rehabilitation, but postpartum recovery is just often treated as a waiting game.
Yeah, just wait and see.
Right. And meanwhile, in countries like France, patients automatically receive a prescription for 10 physical therapy visits specifically to rehabilitate their abdominal and pelvic floor muscles. But here, patients are just left to navigate this huge rehabilitative void.
Which is wild. So whether you are a parent or you're planning to become one or you're just fascinated by human biology, today we are doing a deep dive into a stack of clinical guidelines from Canada and the UK, insights from the Mayo Clinic, a massive randomized controlled trial from China, and some really cutting-edge preclinical studies involving muscle stem cells.
It's a lot of ground to cover.
It is. Because our mission today is to answer a very specific structural question. Can delayed pelvic floor rehab actually worsen laxity after birth?
And to answer that, we really have to establish what laxity actually is on a cellular level, because it's often misunderstood as simply a weak muscle that just needs to be exercised.
Like you just need to do some reps and you're good.
Exactly, but mechanically, it is a massive trauma compounded by a severe physiological and hormonal crash. We have to view the pelvic floor as this dynamic hammock supporting the bladder, the uterus, and the bowel.
Going back to that Mayo Clinic data for a second, stretching a muscle 3.26 times its resting length is, honestly, it's hard to even conceptualize.
It's extreme.
Right, like if you took your bicep or your hamstring and you tried to stretch it 250% past its normal resting state, the micro-tearing of the muscle fibers, the sarcomeres, it would be catastrophic.
The tissue strain is monumental. Under normal circumstances, when a skeletal muscle sustains that level of trauma, the body just floods the area with resources to repair the micro tears.
That makes sense.
But the postpartum environment is not normal. Beyond that physical stretch, there is a massive hormonal cliff that you fall off of.
Yeah, I was reviewing the clinical notes from Encore Therapy, and the numbers are just staggering. During pregnancy, a patient's estrogen levels increase by over 100 times the pre-pregnancy baseline.
Huge surge.
And then immediately after birth, those levels just plummet. It's a more sudden and dramatic hormonal shift than menopause.
So why does that specific drop matter so much for the muscle's ability to recover from that 250% stretch?
Well, estrogen is far more than just a reproductive hormone. It's a critical regulator of tissue health. It actually stimulates fibroblasts.
And those are the cells that make collagen, right? Exactly. They're responsible for producing collagen and elastin. So when estrogen levels plummet, collagen synthesis just stalls. And on top of that, low estrogen reduces local blood flow to the pelvic floor muscles and the vaginal tissues. Oh, wow. So the tissues become thinner, they get drier, and they lose their vascular support right when they need it the absolute most.
And we also have to factor in relaxin, right? That's the hormone that actively softens the ligaments to, allow the pelvis to widen for delivery.
That is the second piece of this hormonal puzzle. Relaxin actually alters the extracellular matrix. It upregulates specific enzymes called matrix metalloproteinases.
Okay, big word. What do those do?
They literally break down collagen fibers to keep the joints and ligaments hypermobile. And the catch is, relaxin stays in the system well into the postpartum period, especially if a mother is nursing.
Wait, really?
Yes. So you have these enzymes actively keeping tissues loose, while the hormone needed to rebuild the tissue, the estrogen, is virtually non-existent.
Let me try to put this in structural terms. If the pelvic floor is a hammock, it's not made of canvas. It's like a hammock made of elastic bungee cords. And during delivery, those cords are stretched to their absolute physical breaking point.
Right.
Then that hormonal crash essentially turns off the humidity in the room. So the elastic cords dry out, they become starved of nutrients, and they completely lose their snap.
That captures the mechanical and chemical environment perfectly. The tissues are physically overstretched, they're micro-torn, and simultaneously deprived of the biological tools required to rebuild.
So if the tissues are in that much distress, it brings up a really crucial question about the cells themselves. Is the muscle tissue permanently destroyed, or is the body's repair mechanism just failing to activate?
That's the million-dollar question.
Right, because looking at the sources, the answer involves a highly complex relationship between lactation and muscle stem cells.
But the repair mechanism is profoundly compromised.
Right.
There is this fascinating preclinical study on rats published in MPJ Women's Health that looks specifically at muscle satellite cells.
Satellite cells.
Yeah, these are the stem cells that reside on the periphery of skeletal muscle fibers. They just lay dormant until a muscle is injured. And at that point, they multiply rapidly, they fuse with the damaged muscle fibers, and they repair the tissue.
Which is how any muscle grows or heals, right?
Yeah.
Whether you're lifting weights at the gym or recovering from a sports injury.
Right, exactly. And the study showed that if a rat goes through a spontaneous vaginal delivery without any localized tearing, the trauma of the birth process naturally triggers a massive systemic increase in these satellite cells.
Okay, so the body recognizes the strain and sends in the repair crew.
Normally, yes. But the researchers found that if the rat is lactating, this stem cell proliferation is completely blocked.
Completely blocked. And the sources emphasize that they found this blockade not just in the pelvic floor, but in the tibialis anterior, which is a muscle all the way down in the leg.
Yeah, it's a systemic blockade. The systemic hormonal environment of lactation, specifically the low estrogen and the high prolactin, needed to produce milk, actively suppresses the body's ability to repair any muscle tissue.
So the stem cells are basically forced into a state of inactivity.
Exactly.
Mm-hmm.
The biological machinery required for rapid muscle regeneration is essentially powered down so that energy can be redirected to milk production.
I just have to grapple with the evolutionary biology of this for a second because natural selection usually optimizes for survival, right?
Sure.
So suppressing a mother's ability to heal her own musculoskeletal system systemically to the point where her pelvic floor and her leg muscles can't repair themselves, that seems like a massive design flaw.
It sounds counterintuitive.
Right. A mother who can't move efficiently can't forage, and she can't defend her newborn. Why would the body prioritize lactation at the expense of basic physical recovery?
It really comes down to a harsh metabolic triage. Milk production requires an astronomical caloric and calcium expenditure. The body views the immediate survival of the offspring as the single most critical evolutionary imperative.
Over the mother's own healing.
Yes. If the maternal body allowed those satellite cells to activate and start rebuilding muscle tissue all over the body, it would drain massive amounts of energy and nutrients away from the milk supply. The maternal body deprioritizes its own long-term function to ensure the short-term metabolic demands of the newborn are met.
Wow, it's a literal biological sacrifice.
It is.
The body determines that the newborn surviving the next 6 months is more important than the mother having a functional pelvic floor in 10 years.
Yeah.
So for anyone listening who has ever felt like their body was physically refusing to quote-unquote bounce back while breastfeeding, it's not in your head. Your satellite cells were literally under chemical orders not to repair you.
It is a profound systemic blockade. However, the researchers did discover a fascinating localized override to this system.
The simulated injury protocol.
Yes. They found that if there is an actual localized injury, such as a simulated birth injury, involving direct physical trauma to the pelvic floor muscles themselves, the signals actually change.
Oh, interesting.
The severe local damage creates this intense inflammatory cascade. Macrophages and local cytokines send out such a deafening distress signal that they actually override the systemic lactation block.
So the local alarm bells are just so loud that they drown out the prolactin's do not repair orders, but only at the site of the catastrophic damage. The leg muscles stay dormant, but the pelvic floor stem cells finally wake up.
Precisely. The body will ignore general maintenance, but it will attempt to patch a critical structural failure. Yet we have to remember the context here.
It is.
Even with those local stem cells waking up, they're trying to rebuild a 250% stretched muscle in an environment with no estrogen and high relaxin. It is an incredibly hostile environment for tissue organization.
Which really forces us to look at the consequences of doing nothing. I mean, if you are in this transiently weakened, hormone-depleted state, and you follow the standard U.S. advice to just wait 6 weeks before seeking care, what is actually happening to those tissues?
Well, delaying guided rehab basically guarantees poor tissue organization. The research from UC San Diego highlights that without proper mechanical loading, and by that I mean guided, intentional movement, the body just doesn't know how to align the new muscle fibers.
Because it needs a map.
Right. When muscle fibers die from the trauma of birth, they need to be cleared out. If you delay care, The body suffers a deconditioning effect, and it fills those microscopic gaps with rigid scar tissue.
Fibrosis.
Fibrosis, exactly. Instead of laying down healthy, flexible type I collagen, the fibroblasts essentially panic and dump disorganized type 3 collagen to patch the holes.
So it's just a messy patch job.
Yes. The muscle becomes stiff, weak, and highly dysfunctional.
So doing nothing locks in the dysfunction. You're giving scar tissue a 6-week head start. But the alternative most people are given is honestly just as bad. You mentioned pelvic floor recovery to almost any medical professional, and the reflexive advice is always just do Kegels.
Which is one of the most persistent and, frankly, damaging myths in postpartum care. According to clinical reviews and guidance from the UK's National Health Service, up to 50% of women perform Kegel exercises incorrectly when they're just told to do them without supervision.
50%. And that's usually because they bear down instead of lifting up, right?
Exactly. They treat it like they're trying to force a bowel movement. This massively increases intra-abdominal pressure.
Oh, that sounds bad.
It is. If the pelvic floor is a weakened hammock, bearing down is like placing a heavy boulder into that hammock.
Yeah.
You are pushing the organs further into the overstretched tissue, actively worsening the laxity and increasing the risk of prolapse.
And even if they are doing the physical motion correctly, there is the whole issue of the tissue state itself. Many postpartum patients don't just have a loose pelvic floor, right? They have a hyperactive, tightly guarded pelvic floor.
Yes, the trauma of birth often causes the nervous system to lock the pelvic muscles in a shortened protective state just to prevent further tearing.
It's guarding.
Right, guarding. Additionally, a patient might be subconsciously clenching those muscles all day long in a desperate attempt to hold in urine leaks. So the muscle is already exhausted from firing constantly.
Let me use an analogy here. Think about trying to rehabilitate a torn bicep by walking around all day with your elbow tightly bent, flexing the muscle as hard as you can. You are just burning out the muscle spindles. If you then try to do 100 active contractions, which is what a Kegel is on top of that locked bicep, you aren't building functional strength.
Not at all.
You are just fatiguing a muscle that is begging to be lengthened.
You are pushing an exhausted muscle past its breaking point. A muscle cannot contract with functional power if it does not first know how to fully relax and yield.
That makes total sense.
This is exactly why throwing blind Kegels at a postpartum patient can drastically increase pelvic pain and make laxity so much worse.
Okay, so if doing nothing guarantees fibrosis and doing blind Kegels guarantees exhaustion and improper pressure, we clearly need an entirely different blueprint. And the clinical guidelines published in the International Journal of Sports Physical Therapy outline a highly structured progression.
They do.
And the timeline completely upends the standard 6-week waiting game. They state that rehabilitation should actually start in the first 0 to 2 weeks.
Right. But we should clarify, Phase 1, which covers days 1 through 14, is not about strength training. It focuses purely on neurological connection and managing pressure. And the primary tool here is diaphragmatic breathing.
We have to explain the mechanics of this because I think to a lot of people it sounds too simple. Like, why is breathing the intervention for a torn pelvic floor?
It's a great question. You have to view the abdomen as a sealed canister. The diaphragm forms the roof of the canister, and the pelvic floor forms the base.
Okay, roof and base.
Right. And they operate together like a piston. When you inhale deeply, expanding the ribs 360 degrees, the diaphragm pushes down. This shifts the internal organs downward, and the pelvic floor must naturally yield and drop to absorb that pressure.
It catches the weight.
Exactly. And then when you exhale, the diaphragm rises and the pelvic floor naturally recoils upward.
So phase 1 is really just sinking the piston. You are teaching the pelvic floor to yield and recoil properly so that every time you breathe, laugh, or cough, the pressure doesn't just slam into an unyielding or overly loose hammock.
It reestablishes the reflexive pressure management system. This phase also includes gentle pelvic tilts and strict avoidance of heavy lifting. It basically reminds the brain that these structures exist without actually loading them with weight.
Okay, and then we move into phase 2, which is around weeks 3 and 4. This is where we start targeting the transverse abdominis, right? That deep core corset muscle that wraps around the spine.
Yes. We introduce short duration walks, perhaps 10 to 15 minutes, to encourage blood flow. But crucially, this phase involves practicing the active relaxation of the pelvic floor.
Active relaxation.
The patient learns to let go of that protective guarding we talked about, lengthening the muscle so it can eventually generate force.
It's only after a month of breathing, pressure management, and conscious relaxation that we finally reach phase 3 at the 6-week mark. And the Chinese randomized controlled trial, the PFLOW study, provides just undeniable evidence for what happens when we use this timeline.
It's a fantastic study.
Mm.
The researchers tracked a massive cohort of women. At 6 weeks postpartum, the control group received standard general lifestyle advice, but the intervention group engaged in a comprehensive, supervised, online pelvic floor training program. And they followed these women for a full year.
And the results were definitive. The women who engaged in the structured, progressive training had significantly higher rates of normal muscle strength at 1 year postpartum, 56%, compared to just 43.4% in the control group.
Over 10% more women completely regained normal functional strength simply because they engaged in a structured plan rather than relying on hope and time.
Right.
And the timeline itself is a vital piece of education. The traditional 6-week clearance implies that healing is finished. In reality, true collagen remodeling and recovery of the pelvic floor takes 4 to 6 months at an absolute minimum.
And in many cases, it takes up to 2 years to fully organize that tissue. The 6-week mark is just the clearance from acute medical dangers like hemorrhage or severe infection. It is the starting line for musculoskeletal rebuilding. It's not the finish line.
Exactly. If we treated postpartum recovery with the same respect and progressive loading that we apply to an ACL tear or rotator cuff repair, we would see a dramatic reduction in chronic pelvic floor dysfunction, prolapse, and incontinence.
So, to synthesize the mechanics of what we've covered today for you listening, laxity is a cellular and structural failure. The tissue is stretched over 250%. It's starved of the estrogen it needs to build collagen. It's bathed in relaxin that keeps it unstable. And it's locked out of its own stem cell repair system by the metabolic demands of lactation.
It was a perfect storm.
It really is. And if you delay rehab, the body fills the gaps with stiff, disorganized scar tissue. If you try to fix it with blind kegels, you fatigue an already guarded muscle and drive pressure in the wrong direction. The only way to prevent long-term dysfunction is early, guided physical therapy that reestablishes a diaphragm piston, teaches the muscle to relax, and then progressively loads it over months.
That is the mechanical reality of the postpartum pelvis as we understand it right now. But looking ahead, the preclinical research suggests that we might soon have tools to alter that hostile local environment directly.
Right, the bioengineers at UC San Diego.
Yes. They haven't just been studying rat models to understand the damage. They have actually developed an acellular injectable skeletal muscle, extracellular matrix hydrogel.
Okay, an extracellular matrix hydrogel. How exactly does a gel tell an overstretched, hormonally starved muscle to grow instead of scar?
Well, it acts as a biological scaffolding.
Scaffolding.
Yes, the hydrogel provides a highly organized 3D physical structure for those satellite stem cells we talked about to climb onto. But it is way more than just scaffolding. It provides targeted biochemical cues. The hydrogel contains specific peptides that signal the local immune system to actually dial down the macrophages that cause fibrosis.
Wait, so it stops the body from panic dumping that type 3 scar tissue?
Yes. By preventing that macrophage-induced fibrosis and giving the cells a physical matrix to align themselves on, the muscle is encouraged to regenerate with healthy, flexible fibers.
That's incredible.
When they injected this hydrogel directly into the pelvic floors of rats after a simulated birth injury, it successfully prevented muscle atrophy and stopped the buildup of scar tissue. It literally changes the local microenvironment from one of scarring to one of true regeneration.
So we are essentially looking toward a future where a minimally invasive injection right after delivery could provide the exact architectural and chemical support the tissue needs when the body's natural systems are suppressed.
Exactly.
It takes the burden off the exhausted system and hands the cells a blueprint for perfect healing.
It really represents a paradigm shift in maternal care, moving away from passively waiting for damage to become chronic and moving toward actively engineering optimal recovery at the very moment of injury.
The expectation of precision in medicine shouldn't just be reserved for a torn knee ligament. The postpartum body goes through one of the most extreme physical and metabolic events in human biology, and it deserves a protocol that is just as clear, just as respected, and deeply rooted in cellular science. Thank you for joining us on this deep dive. If learning the actual mechanics of laxity and tissue repair sparked an aha moment for you, please share this vital, heavily under-discussed science with the people in your lives who might need to hear it. Until next time.